हेलो गाइस, वेलकम टू दिस अमेजिंग यूट्यूब चैनल एरा ऑफ मेडिकोज। एंड आज अपन ऑस्टियोलॉजी का सेकंड पार्ट, सेकंड बोन, शोल्डर गर्डर का सेकंड बोल स्कैप्यूला करने वाले हैं। तो बहुत ही इंटरेस्टिंग बोन है। देयर आर लॉट्स ऑफ अटैचमेंट इन दिस दैट वी हैव टू स्टडी। सो जस्ट वॉच द वीडियो. So let's talk about the scapula first. What is a scapula? So first of all, let me show you. It looks like this. Here it is your process of a scapula. The clavicle is will be present here, right? And here will be the ribs. Okay. So no, let's not talk about that. First, talk about what is a scapula, how it is different from other bones. Okay. So first of all, what is a scapula? A scapula is a flat bone. It is triangular in shape. What is the position of a scapula? So the position of a scapula is between your second and your seventh rib. Okay. It has four parts. What are those parts? First is your body. Second is your spinous process. Third is your acromion process. And fourth is your coracoid process. Now let's talk about body in detail. So body. So body is triangular in shape and it is thin. It has two surfaces. One is your costal surface, the surface which is facing the rib cage or the interior forward position, and the second is your dorsal surface, that means the back of the scapula. It has three borders: superior, the upper border; inferior, inferior is the angle; lateral is the border; and medial is the border. Of course, the medial border is on the external side and lateral border is on the humerus side. Now, what about the angle? So it has three angles. Of course, if it is a triangular bone, of course it has three borders, three angle. That what a triangle means, right? So it has three angles, and what they are called as: one is your superior angle, second is inferior angle, and third is your lateral angle. You should know that the lateral angle forms the articulating site or articulating surface known as glenoid cavity. The cavity for the humerus, head of humerus. Now, there are three processes in the scapula. What are these processes we are going to see? Just remember, I will show you in the diagram. First is your spinous process. Second is your acromion process. And third is your coracoid process. When we were discussing about the clavicle, I have told you about coracoclavicular ligament, acromioclavicular joints, and those things. So now you can recall from that part, that we are talking about this process and this process of the scapula. Now, if we talk about the anatomical position, so how will you grasp the scapula and hold it in your hand? So first, when you hold the scapula in your hand, you have to see that the glenoid cavity should be in lateral position. Okay. Second is your coracoid process, and this process is directed forward. That means it should be in the forward position. So let's continue, guys. We are talking about the coracoid process that is directed toward the forward position. Now the third process is your spinous process, and it is directed posteriorly. That means on your back. Now let's talk about the features and the attachment of a scapula. Features and attachment. Or first let me show you what we are actually talking about. Right. So as you can see that this is the coracoid process here, and this is the acromion process. Okay, this is the lateral border. That means this should be in the position of humerus. So humerus will like this. Okay, so here will be humerus and here will be your sternum. Right, so this is the medial border and this is the lateral border. Okay, and here is your spinous process. If you look at the back of the scapula, then this process here, it is the spinous process which continues to the end where it forms the acromion process. And you should know that the tip of the acromion process superiorly, this is the topmost point of the scapula bone. So when you hold the scapula in your hand, then you should consider that the acromial process tip should be in the topmost point of the bone. Now this is your glenoid cavity, of course. We have talked about coracoid process, spinous process, right? Now let's talk about the features and attachments. So there are surfaces. Let's discuss about them first. So first is your costal surface or the forward facing surface, that is facing into the rib cage. So it is concave in shape, medially and forward. That means forward facing, right? The second is your dorsal surface. It is the opposite. That means it is convex and have a spinous process. So let me show in the diagram that as you can see that this phase is your coastal surface, and this whole face here from here, which contains the spinous process, this face is actually your what actually your dorsal surface. Now there are lots of things we have to see in the dorsal surface, like there is a spinoglenoid notch. And where it is present between spinous process and dorsal surface. Okay. Now the second one is your supraspinatus muscles. So these are the attachments we are talking about with the dorsal surface, of course. So supraspinatus muscle, it is in the medial two third of suprafossa, and the second is your infraspinatus muscle, and this will be in the sorry, this will be in the medial two third of intrafossa. You were thinking that what this suprafossa and infrafossa is. So let me to tell you that this whole is the dorsal surface of the scapula. Now the dorsal surface of a scapula is divided into two parts through this spinous process. That means one is your upper part and one is your lower part. So this part is called as supraspinous fossa because it is divided by spinous, and this is superiorly, so it is called supraspinous fossa, and the downer part it is known as the infraspinous process fossa. There are three more muscles here which have the attachment with the scapula, and these muscles name are teres minor, teres major, and the last one is your latissimus dorsi muscle. We will talk about all these muscles in detail in the coming part of the upper limb. Now, when we talk about the three border of the triangle, the three border of this triangular shaped bone scapula. So when we talk about the borders, so there are three borders. One is your superior border. What is this? This is the shortest border. The second one is your lateral border, and it is the thickest border. The third one is your medial border, and it is thin border. Okay. Now the medial border have some attachment of muscles. That first is your serratus anterior muscle. The second one is your minor muscle, and the third one is again rhomboideus major muscle. Just remember the name for now. All these are in the dorsal aspect. No one of these are in the coastal surface attachments, right? Now if we are talking about a triangular bone, then we should have angles also. So we have three angles in the scapula. One is your inferior angle, the second one is your superior angle, and the third one is your lateral angle. Let me show you where these are. So when we see this, that the scapular bone, so this angle here, this angle of the triangle which is in the lower side, this is called the inferior angle. and this angle which is on the superior side, this is called as the superior angle. And here it is the angle on the lateral side of the scapula, so angle is called as the lateral angle. You can see that this is the superior border here, this is your the medial border, and this is your the lateral border, and it is the thickest border here, thickest border of the scapula. It is the thinnest border, and the superior border, it is shortest border. You can see also that it is just this much. Now we have talked about the angles, we have talked about the processes. Let's talk about the ossification process. So ossification is cartilaginous in a scapula, and there are 8 centers of ossification. There is one primary center in the body, and there are the secondary center which are two in coracoid process, two in acromion process, and one each in the medial border, inferior angle, and lowest rim of glenoid cavity. Let me show you where is the lowest rim of glenoid cavity is. So this is, if we if you saw this, this is the glenoid cavity you have. So this is the lowest rim and this is the upper rim. So here, somewhere here is the for one ossification center. Now let's talk about the fusion and appearance of these ossification center. So the coracoid one is does appear in 8th week of IUL and fuses at 15 years. But all of the other centers appears during puberty and fuses by when you are 20 years old. So actually at this stage, when you are almost 19, 20 or 21 years old, you are you have 3 or 4 ossification centers which are actually fusing in the scapula, and further ossification of scapula will not take place after they will fuse. So don't break your scapula. Now let's talk about some clinical facts about scapula. Of course, it contains the so there is a deformity of a scapula that is known as Sprengel's deformity. And what happens in this, that it is first of all it is congenital. Now what happens in this, that a scapula doesn't descend, that it is growing somewhere but it cannot descend normally to this point. that means the lower part, of course. In this case, the scapula is hypoplastic and remains in neck region, as it was not able to descend in the back of your body, so it remains in the neck region. And you should wonder that if you try to bring the scapula from the neck region to your back by using surgical methods, then actually you are causing injury to your brachial plexus, and that will be almost fatal. So this is all about the scapula. Let me show you, if I can show you some. So first of all, this is the coracoid portion. Let's talk about this. So in the coracoid portion, this is actually the coastal surface, that means the anterior view of the scapula. And in this you can see that the pectoralis minor attaches to this point, the coracoclavicle ligament attaches to this, coracoacromial ligament attaches to this point, the short head of biceps brachii and coracobrachialis attaches to this. Actually, the your biceps muscles have two or three heads. One of them is the short head, and that head attaches to here. Now we have talked about the glenoid cavity, and the long head of triceps muscles attaches to this point. Here is the triceps muscles attaches, here the biceps muscles attaches. It is the subcapsularis. This is the superior angle. This is the suprascapular ligament. Here, this is the coracoclavicular ligament. I have to told you something about suprascapular ligament. So actually, what happens that between the coracoid process and the spinous process, there is the normally there will be a space, but in some cases there is a ligament present here. A ligament is present between them, attaching the two bones or the two process, that the spinous process with the coracoid process. But what happens is sometimes that the ligament ossifies, and when anything ossify, it forms a bone. So when it ossifies, a bone is formed here, and because of that bone there is a space formed formed in between the suprascapular ligament and the junction of the two processes. And actually what happens that this junction allow the upcoming of blood vessels and nerves from the dorsal part to the coastal side. Now let's talk about the second one. So here on the spinous process, your trapezius muscle attaches. All other things are the same. Here teres minor attaches. Here long head of triceps, as I told you. Teres major attaches here. You should know that teres, in case of teres muscles, the major is on the lower side and the minor is on the upper side. But what happens to the other side, that yes, the latissimus dorsi is on the inferior angle. The rhomboidus major attaches to this, and the rhomboidus minor is attached to this. So here also the major is attaching the below part and the minor is attaching the upper part. But what is the difference between them? The difference is that the teres minor size matter. The teres minor attachment size is more than attachment of teres major. Okay, so this diagram is also completed now. This is the supraspinatus fossa, this is the infraspinatus fossa, because it is divided by the spinous process. This is the topmost point of the scapula. Here the deltoid muscle attaching. All of these muscles are going to be discussed in detail. This diagram I have already explained you. This is the lower lip of your spinous process, and this is the upper lip of your spinous process. There is nothing more. See, I am talking about this thing. As you can see that this thing, supracapsular nerve is coming from this to this direction. You are seeing from behind the spinous process, of course. So actually here it is the supracapsular ligament present which ossify and forms a bone. In some cases only, not in all cases. So we have completed the scapula part today, and hope that you understand all of these. Thank you for watching the videos and supporting. Just keep supporting like this, and by the time you arrive at the college or you start the study, I think lots of videos are going to be on this channel, and these are not going to be like distributed in the video section. I upload the videos and put them in a particular playlist just made for that, so you will find it very easy to find them, not like just scrolling the past videos and just thinking that after I teach you the upper limb, then I started general anat and then histology. So that will be not the case, because whatever you want to see, just go to the channel, go to the playlist, and watch whatever playlist you want. The videos regarding any of the topic will be in that playlist only. Actually, myself, I found that very disturbing that some of the YouTube channel, there are various videos which are not properly adjusted in the playlist. It is just in the video section, and we you have to just scroll and find out, and that is very time consuming. So I'm not doing that. I'm putting every video in the respective playlist of them. So
Like, share, comment, and press the subscribe button and press the bagal wala bell button to get the latest update. Goodbye, guys.